Good evening. I'm Councillor Graham Bridgman and I am Deputy Leader of West Berkshire Council. I'm the Executive Portfolio Holder for Health and Wellbeing and I am the Chairman of this board. I'm supported by Councillor Joe Stewart, who is Vice Chairman of the board, and the other members of the committee in attendance this evening are Councillors Dominic Burke, Lynn Doherty, Steve Masters and Martha Vickers, as well as Nick Carter, Matt Pearce, Joe Reeves and Andy Sharp. Other officers present to advise us are Martin Dunscombe, Sean Murphy and Sarah Rainfield, and Gordon Oliver is clerking the meeting and will be the Zoom host. So, as is tradition, I'll ask Gordon to run through some standard reminders about the way that we run council meetings on Zoom. Gordon.
Thank you. In addition to the points shown on screen, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised a Zoom hand has spoken, anyone who has telephoned in will be invited to speak in order. Any voting will be done via show of physical hands, and if we need to adjourn the meeting for any reason, then you'll be advised of the revised time and date of the meeting. If it's a short adjournment, you can rejoin this meeting. Otherwise, a fresh appointment will be sent out. Do members have any questions?
No? Okay. Gordon, do we have any apologies for this meeting?
I haven't received any, Chairman.
Thank you. Members, you will have received in your pack the minutes
Excuse me, Chairman.
of the meeting. Of course.
Chairman, I must leave this meeting by 7 o'clock. If I leave before the end of the meeting, please accept my apologies.
I hope that we won't still be running by that time, Councillor Burke, but obviously I'd note that if we get that far. So members, first item is, or second item on the agenda technically, is the minutes of the previous meeting, which were held on the 21st of June. Can I see whether anyone wants any amendments made to those minutes? No hands go up, so I will propose those minutes from the chair. Can I see a seconder for them? Thank you, Councillor Stewart. And I will now ask everyone who was at the meeting and is a member of the board to vote physical show of hands as to whether they agree the minutes. I think those are accepted. Thank you, Gordon. Okay. Next item is declarations of interest and a question for Gordon. Have we been notified of any?
Nothing in advance of the meeting, Chairman.
Thank you. And that being the case, do any members wish to raise a declaration at this point? No? Right, well, let's get on to the meat of the meeting. And the first item on the agenda is COVID-19 situational report. And for that, I'm going to ask Matt Pearce, who is the Service Director for Communities and Wellbeing, to give an update. Matt.
Thanks, Chair, and evening, everyone. So just going to take you through a few slides. Got quite a few to go through, and I know people are quite interested in our rates at the moment. And I've also just put a slide at the end just to cover what's just been announced by the Prime Minister, just to let the public aware of what's happening going forward. So just with the overview in terms of where things are, obviously there's been a marked change since we've last met. So as always with this table, just gives a summary of each of the local authorities across Berkshire. We've highlighted West Berkshire with a yellow box here. So the first column is around individuals tested per 100,000. So as you can see, the majority of the local authorities, or a few of them have, West Berkshire, Bracknell and South Eastern England, the testing rate has gone up. And we're actually seeing that at our local PCR testing setting at Newbury Showground as well. So, and that's reflected then in the positivity in the cases per 100,000. So again, we're seeing all local authorities regionally and England as well, the positivity rate is going up. So that's a proportion of individuals that have tested positive is 2.6. And when you look to the cases per 100,000 for all ages, again, all local authorities and the regional and the national average is going up. I think the most recent data that's come out today shows West Berkshire to be around 101 per 100,000. So we're all now in the red. Reading is a bit of an outlier in terms of being higher than the national average, which is 208. They're at 254. And members will be aware that there's been surge testing recently undertaken in that area. I know they're having some specific high rates with regards to young people as well, and university students, which has contributed quite significantly to some of that rise. And then in terms of cases per 100,000, West Berkshire remains the lowest out of all local authorities and lower than the regional national average, and that's 9.9. And I probably should have said in terms of our case rate per 100,000, again, we're still the lowest out of all the local authorities and below the regional and national average. That's not to say that rising rates is a good thing. Clearly, we're concerned. Councillor Bridgman, did you put your hand up?
Well, I was going to wait till you got to the end of your presentation on the slide, but I didn't want you to move off this slide because obviously, well, I say obviously, the number that's leaping out at me is the difference in the obvious background in adult social care and the interest that we had previously in the numbers of the slightly older population. The 60 plus number seems quite stark when one compares our 60 plus number with a relative average through the other authorities, indeed the South East and England as a whole. And then when one compares Slough, do we have any intelligence as to what on earth's going on there?
No, I don't. Is the bottom line to that. I can certainly look into that to try and understand why that might be, or when the panelists might have an idea. But no, we are certainly a lot lower. I mean, I guess Wokingham is kind of demographically, comparator sites, and they're about 20.3. Obviously, some of the other areas have higher younger people. But these are, we do try and standardise it by rates, but there might be smaller numbers of older people in those specific areas that might lead to their higher rates. But I can certainly take that away and get back to you. But it's a positive thing for West Berkshire, that's for sure, because obviously we know that older population are more adversely affected. And then in terms of numbers, obviously we're looking at 133 on a 7-day average. We've had 2 community outbreaks. So in total, there's around 7,000 COVID cases in West Berkshire since the beginning of the pandemic. Nationally, they're looking at a doubling rate of every 9 days. And I think the view is that these rates will continue to climb. Obviously, I'll go on to hospital admissions later on, but we anticipate that these rates will continue to climb, particularly as we move to step 4 and restrictions are further released. So again, this just summarises each of the local authorities. Again, Reading's just really the standout here, because you can see the blue line representing the local authority cases, the orange is South East, and the grey is England. You can just see that Reading is obviously just creeping higher than the regional and national average, whilst the other local authorities are either broadly in line or slightly below. So I just alluded to that in my chart, and what has been the case for a few weeks now, which obviously reflects the vaccination programme. As you can see, with this heat map, we have the ages on the left-hand side, and then the darker shade of colour represents the higher number of cases per 100,000 within that specific age range. So as you can see from the older ages, there's a lighter shade of yellow, which means hardly any cases, if any. The green, obviously, there's a few cases, and then the darker blue and purple representing higher rates per 100,000 of specific ages. So as you can see, anything really from 10 to 29 is really where we're seeing the vast majority of our cases. And we know they're the ones that are only recently been invited to have their vaccination. So again, reflects success of that rate. And we're seeing that in our outbreaks as well in schools. And younger people, and I've obviously alluded to university, and it could be individuals that go to university in Reading and other areas. I see Councillor Masters has put his hand up.
It's just for the end of the presentation. Matt was just getting prepared.
Again, I just wanted to reflect on the age-sex profile of cases. So we've got all weeks prior of the pandemic. That was mainly between January and June, and the most recent 7 days. Interestingly, we're starting to see more in males, and we've tended to see more cases in females, generally because they're more aware of their symptoms and coming forward to testing. But we are seeing more in males. So just an interesting observation there. Also just included this graph, which just shows the proportion of cases specifying symptoms at times of testing. So really this just illustrates that actually we're still seeing a lot of positive cases in people who are asymptomatic, and that's largely down to the increased availability of lateral flow testing. So the orange bar just representing West Berkshire here, the light blue Berkshire and the dark blue England. And you can kind of see for West Berkshire, you're looking at around 35% of all those people that test positive have symptoms. Just showing again, regular testing continues to remain an important measure for us going forward. Cases by electoral ward. So again, we've got, this is over 2 weekly rates now, and the reason we moved to 2 weekly was because numbers were quite low. We might have to move back to weekly going forward. So there's a few outliers. Aldermaston again, so 15 within that specific 2-week period, which represents a rate of 393. So just needs to be mindful of the numbers and how they equate to rates. Again, Tarhurst, Purley, we've seen quite a high number of cases there, which we know are on the border of Reading. And that's reflected in this map here. So again, you'll recollect a few weeks ago and possibly months ago, we had periods where it was completely white, where the rates were really low. And obviously we're just starting to see that map get populated in lighter shades of blue and darker shades as we see the virus kind of work its way across the district. So obviously the really important information, whilst cases is still a concern, whether it's regard to long COVID and those consequences. Obviously the admissions are a good indicator, and we know now that the vaccination has weakened that link between cases and hospitalizations, but the link is not completely broken. So the latest data we had is there are 3 new COVID-19 admissions, which is on the 27th of June. And you can see that to the far right-hand side of this graph compared to the other waves. And the same when we're looking at the number of patients in RBH as well. So they remain low. And there were 3 patients in hospital with COVID-19 on the 29th of June 2021. So what I tried to do then was actually just help put that into context. I'll try and explain this graph for you. We've got the number of cases which represent these dark green bars. And this is the, well, 3 waves, if you like, the first wave to the left, the second wave in the middle, and we are embarking the 3rd wave on the right. The purple pinky line represents the number of deaths during that wave, and then the red line represents the hospital admissions. So clearly we weren't testing as much in the first wave, which is why the cases aren't as high here, but they were likely to be going undetected. And as you can see for the 3rd wave, we're seeing that thankfully the number of deaths remain low, and those admissions remain low. And when you compare that to the other 2 previous waves, you can kind of see the success that the vaccination program is having. And just at the bottom, we've just reflected that in terms of the ratios. Again, this is just some broad kind of figures for you. So now 1 in 164 that potentially admitted who've had cases. So again, yeah, really, really positive news. And I think what we just need to be guarded about is these rates will go up, as I've mentioned before. It's inevitable, and we will also inevitably see people who've been double vaccinated go into hospital and also get COVID, as we know the vaccination is not 100% effective, whilst it is very effective. Again, I just wanted to show you really how we're starting to open up things across society, and this is just the exposure indicated by those who get COVID-19. So just by setting, and you can see to the left-hand side, we've got the dates on the bottom, and we've got the settings on the left-hand side. And the small case, the circles represent the number of exposures, and the numbers, the size of the circle represents the number of exposures, and the number, the proportion of exposures. You can just see the circles and the numbers are increasing to the right-hand side as we move along, and we're starting to see people recall where they may have been exposed. There's no certainty by any means, but gives us an indication, and that's obviously increases in education. Hospitality has seen a bit of an increase, in particular in the workplace as well. I just wanted to really summarise some very quick points just from the Prime Minister's speech just now. Clearly, a lot more of this information will come out in a couple of days, but I just wanted the board to be aware of what's coming out. So it sounds like the majority of COVID restrictions will be lifted from the 19th of July, and a final decision will be made on the 12th of July. The vaccination program is still going to be critically important going forward, and that is one of the best defences we have. And the government is looking to reduce the vaccination doses for under 40s to 8, meaning everyone over 18 should be double jabbed by mid-September. There will be a move away from legal restrictions to allow people to make informed decisions about how they manage the virus. So that includes no legal requirements to wear face coverings. And it would be interesting to see what the guidance says around that. I think there will be some advice around certain situations where face coverings or masks might be advised, but clearly it's not going to be a legal requirement anymore. And obviously step 4 will be removal of all legal limits on numbers meeting indoors and outdoors. The limits on named visitors to care homes will be lifted, as well as the limits on numbers attending concerts, theatres and sports events. The 1 metre social distancing rule will end. and then people will be continued to require to self-isolate. That is still really the best defence we've got alongside vaccinations, is that if people have symptoms or they test positive, they will need to self-isolate or are told to by NHS test and trace. And I understand there's going to be some more information coming out around contacts of cases if they've been double vaccinated and whether they need to continue to self-isolate. So we'll await more information on that. And then there'll be further information on school bubbles due in coming days and what the instructions will be in terms of when there's an identified case in the school and what those contacts need to do. I'll stop there. So I notice there's a couple of hands up. Happy to take some questions.
Before I come to members, just a reflection and maybe a question for reflection on the hospitalisation analysis you gave. Clearly, there are some people hospitalised. I guess the question is, how, if I can put it like this, how severe is the hospitalisation? In other words, are they on oxygen? Are they on positive oxygen? Are they in ICU? You know, what is the treatment for that individual in hospital, and how does that compare with the kind of treatments that were going on in the previous waves? And most importantly, how old these individuals going into hospital are, and whether or not they've been vaccinated, and if so, whether they've been double vaccinated. So I don't think we have the answers to those questions. I certainly raised this with Royal Berks, but clearly there's patient confidentiality and various other things get in the way of sharing data. I just think it's an interesting question for us as we look at what the Prime Minister's announced going forward. So I'll invite you just to reflect on that, and then I'll come to Councillor Marston and then Councillor Vickers.
Yeah, thank you. So we are getting to see that information. We're certainly not seeing many on mechanical ventilation or many on oxygen compared to the other two waves. Obviously, treatment's becoming far more effective. So that's certainly the case. Whether that will continue, I think we'll wait to see. But again, that reflects how effective the vaccine has been. We are tending to see younger people being admitted to hospital, or possibly those that haven't been vaccinated or had double vaccinations. So they are forming the large majority across the country. Whether that's specifically to Royal Berkshire, I'm not 100% sure, to be honest, but that's certainly the data we're getting out nationally. And again, just reflects the importance of vaccination to the public, and that obviously it does, prevent severe disease and also death. So we obviously, as time goes by, we can certainly get more information as those numbers increase, and we can give that data back.
Members, before I come to Councillor Marston, I'm told that by our clerk, I'm breaking up. That is I can assure you that's the bandwidth in Market Street. So I shall plug some headphones in and see if that makes any difference. While I'm doing that, Councillor Masters.
Thank you, Chairman. Thank you for the presentation, Matt. And just, I think everybody would welcome the reduced numbers of hospitalisations that have occurred, and as you said, that's a testament to the in large part to the excellent effort for the vaccination programme by the NHS and the hundreds of thousands of volunteers across the country. So I think we can be very grateful for that. I have a couple of questions. One relates to long COVID, which I'll come to in a second. But with the relaxation of the restrictions, pending on the 19th of June, do you envisage any problems or any reason that might be derailed? Are the trends continuing to go up even before the restrictions have been lifted? And then my question about long COVID, are we seeing any growing trend about long COVID diagnosis, both locally and nationally? Thank you. You're muted, Matt.
So I think I'd know by now. Yeah, I mean, just listening obviously to the Prime Minister's speech just now, it sounds like the 19th is going to be, those relaxation of restrictions, and that summary I've just given. So I think there's an expectation that we will continue to see a rise in cases, as I've just stipulated. I think there's an expectation that we will continue to see a rise in hospital admissions, and we may potentially see a rise in deaths as well. So obviously that's a largely political decision in terms of those decisions being made. So I don't see that being derailed if things stand as they are, because hospital admissions are staying relatively low. So that's really the first point. I mean, whether we come to the winter in the future and further decisions need to be made around that. We know that respiratory illness is increased in the winter as well, and that might cause some potential issues. So we just have to keep an eye on that one. But certainly there still needs to be a level of restrictions and people just being precaution in terms of where to wear face coverings, if they're meeting people inside and things like that. Long COVID, I haven't had a recent update. I think some of the challenges with long COVID is an agreed definition of long COVID and how this data is actually collected in primary care. So obviously we get the numbers from the hospitals and the long COVID service. But in terms of how that information is collected, I think that's something that still needs a lot of work. And again, I'm more than happy to bring that back to see what the latest data is around Royal Berkshire Hospital. But they tend to only see those that obviously get quite severe symptoms, not necessarily people that have long COVID, maybe over a few weeks rather than a longer number of weeks.
Thank you. Would you echo Chris Whitty's point about being careful around other people, especially indoors, and maybe wear the masks, if people are uncomfortable, and use that judgment call?
Yeah, absolutely. And I don't think we can rely solely on vaccinations. I think it's a combination approach, which is really what we want to seek. So there is a degree of common sense, people being sensible. If you're meeting new people indoors, then you might want to continue to wear a face covering. That's a personal choice. We know ventilation is equally important. So I guess it's for us to maybe guide the public in where those high risk situations might present themselves and what precautions they may wish to take. But clearly the direction of travel is to leave those choices to individuals. But I'm sure we can support people in guiding those decisions.
No doubt we'll come to some of that when we come to comms. And hopefully this microphone's working better for you. Councillor Vickers.
Hello. Yes, thank you for the presentation, Matt. I don't think this is repetitive, but obviously it's similar to some of the previous. But the point about those who've been double vaccinated being vulnerable to getting COVID. I suppose I'm coming on to comms a little bit here, but I think there's a tendency for those that have been double vaccinated to feel they're invulnerable and to be probably a little bit rash about, sort of how they behave, apart from people knowing that they can pass it on. But as regards their own vulnerability, they feel almost immune, I think, some people. So I think it's important that we get the message out that they can catch COVID, but hopefully won't be seriously ill. And is those that catch it and end up in hospital who've been doubly vaccinated, are we going back to possibly it being more likely to be people who've got some underlying conditions that are more likely to be sick, that not the relatively fit double vaccinated? I don't know whether there's any information about that. And also the business about mask wearing, again, about our own local, coming on to comms later, I know, but the mask wearing, I think there have been comments about people not being overly selfish by people that have talked, when you are going somewhere, possibly into a coffee shop or on public transport or something, when the poor person who's actually working in that area has been at it all day, it isn't just in and out, you're protecting the people around you. It's not just about you. So think about your mask wearing a bit like the Japanese do. We should be developing a different mentality, that it's not just about, oh, I'm okay, they've told me it's okay, therefore anything goes. Just be cautious and think about other people. And I don't know that we're getting a good message like that from the central government. And it would be good if we locally were sending out a message about thinking about everybody around you, not just yourself.
Happy to come back to some of those. So double vaccination, I think that's a really good point. And I think there's something around behaviour science here about how we communicate with people that actually, whilst being double vaccinated, they can still transmit the virus. So we know that from the data. So yes, it protects from mortality and morbidity, but actually transmitting the virus, we know that actually they can still do that. Also, actually, that obviously immunity takes a while to build up, even after one vaccination, two vaccinations. So we need to communicate that message. So Sarah might want to cover that in her presentation in a bit. In terms of long-term conditions, underlying conditions, I haven't seen any data coming through in terms of those that are being admitted. Like I said, the majority are those that have been unvaccinated or had a single dose of the vaccination rather than those who've been double vaccinated. But over time, that evidence will be gathered to actually see whether it is those with underlying conditions that have been double vaccinated that go into hospital. But as I said, we will see more people with being vaccinated will go into hospital just because it's not effective, 100% effective. And then masks, I completely agree with you. I think there is that personal responsibility to respect other people, and we have to remember face coverings protect others, not necessarily yourselves, depending on the face mask that you wear. So it is very much face coverings. People want to double layer their face coverings. That can add extra protection as well. But I think you have to, like you would say, think about other people. There's still people that haven't been vaccinated and they can't for various different reasons. So I think it's important to get that message across. I see Meriden hands up, so I don't know if you wanted to add to that, Meriden, or different answer.
I was actually just going to make a point about long COVID, actually. I was just going to say that the Office of National Statistics is doing surveys of the general public, and they're estimating about 1.5% of the population have got long COVID, but that's all self-reported because the vast majority of them are not actually going anywhere near hospital. It's very similar, what we've heard before, it's similar to symptoms of epi and fatigue. And the vast majority seem to be over the age of 35 and people who have had some long-term conditions. So it's quite a big chunk of society in morbidity in terms of 1.5%, if that's what it really is. And just picking up on the point that Matt made about hospitalizations and vaccines. I've not seen anything locally to give us any indication of how many people are hospitalized with or without vaccine, but the numbers are very small, but they are collecting it nationally. And I think, as Matt said, I think they suggested something like between 10 and 20% of people hospitalized have been vaccinated. So there is a small percentage. But in terms of the numbers in the Royal Berkshire, I mean, I think today they suggested there was one person in intensive care, but nobody else in the whole of the hospital. It was just one person. Last week, there was nobody in intensive care, but intensive care was full. There were no spare beds, but nobody with COVID. So it's a changing picture every day, and the numbers are very small.
Thank you, Meriden. Indeed, I would bear that out about the data that's coming out of the Royal Berks. It fluctuates, to put it mildly.
Yeah.
Now, members, if there are no more questions on that item, what I'm going to do is suggest that we look to items 5 and 6, which are both on the vaccination programme and uptake in sequence. So I'll take Joe and then Sarah. Members, could you hold your questions until the end of both? Because some of it you may have questions that arise from both, you may have questions that arise from one, but it's all going to be about vaccinations. So bear with us while we get through the two. Joe.
Thank you. I'll begin, as I have done recently, with sharing the National COVID Dashboard, which is updated every day at 4 p.m. I'm hoping you can see a lovely blue graph. Yep. So this data was released at 4 p.m. today. It's more up to date than my usual slide deck, but lacks the granularity. So just to give you the main headlines, 114,000 people in West Berkshire have received their first dose. Just under 83,000 have received their second. And going down, looking at what that means proportionately, 84.6% have had their first, 61.6% have had their second. Just to do a quick comparison to the UK overall, first is 86.1%, second is 64%. So locally, we're 1.5 percentage points below the UK average. So broadly in line, but slightly behind on both counts. And finally, I wanted to show you the new interactive map that has been uploaded, because it helps us compare ourselves to other areas. So if I come down, I'll prioritise first doses and zoom into West Berkshire. And of course, this will be the time it takes ages to load. So obviously, the darker the colour, the higher the prevalence of vaccination, as with other sort of heat maps. So just showing where we are compared to our neighbouring local authorities in the south. We're broadly in line. We're doing better than Reading in terms of first doses, which is at 67% in terms of first doses. And we've also got Swindon as well, which is slightly behind where we are. And then coming over to second doses, we're also doing quite well in comparison to a couple of our neighbouring authorities, such as Swindon again, Reading, and North Hampshire and Wokingham as well. So I'm going to stop sharing that and go to my usual slide deck. And as mentioned, this always comes with the usual caveats that it is missing a few of the practices data. So we have about 92% coverage of the West Berkshire population, but because this data all comes from practice systems, it does enable us to look at things in more granularity than the national data. And again, just a repetition of the overall vaccination take-up, which for both first and second doses has increased 4% compared to when I last reported 2 weeks ago. I know everybody's interested to look at the age breakdown, which is slowly turning greener as we get into the lower ages at the top of the table. So to note that all over 18s were able to book from the 18th of June for their first vaccinations. This data was captured on the 24th of June, so it would not capture anybody who had an appointment booked but had not yet received the jab in their arm. And there's also a comment here about a higher take-up in Wokingham among the 18 to 29 age group, which might be associated with some of the surge vaccination that was hand in hand with the surge testing. So I'd be interested to see what happens to our figures in terms of the younger age group as we go forwards. But we have seen an 11 and a 12% increase in the 18 to 19s and the 20 to 29. So we're definitely going in the right direction. And again, looking at a breakdown by age and ethnicity, we're seeing more turning green as we get further up the table. The highest rate increase has been among the mixed white Asian and mixed other groups of 9 percentage point each, followed by the Chinese. So we are seeing a shift in increasing levels of take-up in some of the ethnic diverse communities that it had been noted take-up was lagging behind white counterparts. And in terms of those in particular at risk and inclusion groups, the largest amount of activity has been in second doses, as the vast majority of these patients would have been included in the very earliest stages of the vaccination programme. And it's just the youngest that we have left to call in for their second doses on the whole. And then finally, in terms of the most deprived wards in West Berkshire, we are seeing take up, catch up largely. However, particularly in the 20 to 29-year-old age group, take up in Greenham ward is 14 percentage points lower than in the Thatcham Central ward, which I think is notable at this stage. But as we've observed previously, the data in Greenham does tend to catch up. It's just a bit slower than the rest of Berkshire and Thatcham Central. So we'll keep a watchful eye and consider, as we always do, what other targeted information or provision we might need to put in place. But as I mentioned, we do usually see Greenham catch up with other areas, so I wouldn't say it was any cause for alarm. Just a couple of other points I wanted to raise while I'm speaking with you is about the big push nationally to maximise take-up of the vaccination, and doing that through a number of mechanisms. I'll allow Sarah to talk to you more about the Health on the Move van, because she's been working tirelessly on it, so it wouldn't be right for me to take any credit. But I just wanted to highlight that at the Kennet Centre in Newbury Town Centre, they will be allowing walk-in appointments on Friday and Saturday. So if you do know anybody who has been struggling to book an appointment, that's a really good opportunity to walk up and receive the vaccine. And just to highlight as well about second doses, building on Matt's point, from following the government briefing that second doses should be at 8 weeks for everybody. Just to say, if you were considering trying to get your second jab slightly sooner than the 8-week recommended, it's just best to make sure you do leave that 8 weeks in order to get the best sort of immune protection, and also to ensure there are enough first jabs to go around to those remaining in the population that need to come forward to get theirs. But if your second dose is outstanding, definitely come ahead and get your second jab. But otherwise, yes, the remaining 10,000 or so adults in West Berkshire, please do come forward and get your jab over the next couple of weeks. Because as we've discussed at length previously in other meetings and earlier with Matt's information, it is the best level of protection you can get, particularly around the Delta variant.
Thank you, Jo. So swiftly on to Sarah. Vaccine, happy title of vaccine uptake, hesitancy and inequalities, Sarah.
Thank you, Chair. I shall just share my presentation. So, as mentioned, thank you for the opportunity to come and talk about this piece of work, which has been in place now for a number of months, looking at the inequalities in the uptake of the COVID vaccination. So essentially this programme of work started some time ago now with the aim of reducing inequalities in vaccine uptake between the different communities and also between those who are at different levels of risk from COVID. We know that there's 3 potential domains for inequalities in access to the vaccine programme, and that might be due to the wider determinants of health, so geographical reasons, social reasons, or economic factors, but also protected characteristics and those of social exclusion. So the objectives of the work that's been going on, firstly to identify and reduce the barriers to vaccine access, then to identify and address any vaccine misinformation and any concerns among local communities across Berkshire West, to identify community leaders and work within the systems where they're already in place, or to develop health and wellbeing ambassadors where required, working alongside voluntary organisations and facilitating them to support local communities, but also importantly to lay the foundations and build relationships to help address wider health inequalities beyond the vaccination programme and as we move towards recovery from COVID-19. So we're working alongside our counterparts in Reading and Wokingham, so together making up Berkshire West. And this piece of work is led by a programme board, and there's 4 main work streams under which the work has been taking place. So those firstly are to do with data, and so some of the data that Jo just shared, this is monitored regularly, focusing on specific groups, identifying gaps, but also evaluating impact of any interventions, and there's regular reports to local authorities alongside other data streams that are shared. Communications and engagements is a key part of this work, and there's a group that meets regularly, which includes representation from the local authorities, but also Health Watch colleagues, other colleagues from different voluntary organisations and voluntary sector. And together they're looking to identify barriers, working together with different stakeholders, agreeing key messages, but also listening to feedback from communities. In terms of the health and wellbeing ambassadors, this is around identifying key influencers both within the professionals and community, and helping to empower those individuals to help share messages, but also to feed back to us concerns from the community. And then lastly, the mode of delivery. So as the vaccine programme has been going out, we've obviously had the main sites that people can access the vaccine, but we've also been looking at alternative options to try and increase the ways that people can get the vaccine. So this has been around community pharmacies such as the Boots in Newbury, looking at pop-up clinics across the whole of Berkshire West, and then lastly the Health on the Move van, which I'll come to shortly. In terms of what's happened in West Berkshire specifically, so as I've said, we've been doing regular exploration of the data showing uptake. We've been working closely with the voluntary sector and community organisations to understand what the picture is across our area and to highlight particular worries or concerns. We took part in a public survey along with Reading and Wokingham, which has identified lots of reasons why people may not take the vaccine, but also has shown us reasons why people have taken the vaccine, which has helped us to share key messages with different groups. We also helped with the videos around getting the vaccine during Ramadan and helped to address some worries over that time period. And most recently, we've been working with the comms teams around promoting the importance of getting a second dose and how both doses are really needed to get full coverage. We've been working with the Community Conversations Forum that runs in West Berkshire to develop the role of health and wellbeing ambassadors. And as I said, this is enabling us to share messages with that group, but also to hear back from any concerns that are raised as things happen and change. And then the Health on the Move van is enabling us to bring the vaccine to different communities. The Health on the Move van is, as you can see in the picture, it's a sprinter van which has a capacity of 120 vaccines per day. It's staffed by 2 vaccinators. We're running it in our area primarily for booked appointments, and that's to do with the flexibility of the vaccine itself. And as we are usually staffing it with Pfizer and to try and avoid vaccine wastage. While it's in our area, we share it with ourselves, Reading and Wokingham. And so far, during the first week in West Berkshire, it visited 2 saints, hoping to bring the vaccine to the homeless population, and then also to Lambourne. In terms of 2 saints, we only vaccinated a small number of people there. However, it was still a really valuable visit given the vulnerability of these people. And we were really able to address some underlying worries and concerns about the vaccine as well. With the Lambourne visit, we worked really closely with Racing Welfare, and they were really instrumental to bringing, to getting the message out there within the community and helping to bring that vaccine to a very rural population who said themselves that they wouldn't have accessed the vaccine in a different way. In terms of future dates, it is booked to go to the Central Family Hub in Thatcham on the 12th of July and to Newbury College on the 13th of July. And then we're just in the process of confirming a date for it to come to Paces Hill as well. In terms of our next steps or ongoing work at the moment, we're looking to co-host a webinar, which will be specifically around addressing questions about the vaccine. Over the last number of months, there's obviously been lots of things changing, and I think people have got ongoing questions, and we're hoping to be able to answer those. We continue to work closely with our local communities, engaging with them through the voluntary sector and different organisations to understand questions people have. We're now focusing our efforts on promoting the vaccine amongst younger people and understanding their motivations for taking the vaccine. We're working with the community conversations to finalise the role of health and wellbeing ambassadors, which may move more to a term of community champions. And as I said, this is around listening to the community, but also sharing messages and answering questions. And then we're ongoing work to planning future visits for the Health on the Move van. One thing that I didn't mention actually with the Health on the Move van and around the promoting the need for second doses, whenever we book the first dose with the Health on the Move van, we book the second dose at the same time. So really trying to get that message out there that people need to go for both doses. That is all I was going to cover for that. I'm happy to take any questions.
Thank you, Sarah. I think you've, to some extent, assuaged Councillor Doherty's question last time round, because, of course, we were behind this van exercise and saw it going off to do the surge testing piece in Wokingham and Reading, but back in the district and doing some good work, no doubt. So let us take some questions. So, Councillor Burke.
Thank you, Chairman. Yes, thank you, Sarah. As far as the van visits are concerned, I have a question. I noticed that they have been to Thatcham, Lambourne, which are clearly centres of population, suburban population. It's going to Paces Hill. That's a very kind of specific location, and not that near to any large suburban population. I just wonder what they're thinking there. It's in my ward, by the way.
We're specifically going there to engage with the Gypsy Roma traveller community and aiming to sort of bring that vaccine to them to try and, help engage with the community that may be less likely to engage with more traditional routes of the vaccine. So that's the reasoning behind that, and that's working with sort of colleagues to kind of engage with that community.
Thank you.
And Councillor Vickers.
Thank you. Thank you for that. That was quite a lot of information there. Interesting presentations. Keep hearing quite a bit about the work that's being done on health inequalities. I'm not aware of any councillors being involved in this work, but I might be wrong. There's a task force, I believe, particularly as regards identifying health and wellbeing ambassadors. I wondered if there's any communications they're going to councillors, because I would have thought that they, particularly if you're talking about non-professionals, people in the community leaders, I'd have thought they'd be the ideal people to identify, leaders in the communities. And the other question was about on the health on the move ban, which seems great, good initiative. Is there a plan to continue with this type of health on the move ban post-COVID? Could it be used for other sort of health messages, you know, getting into communities that don't automatically come and, you know, maybe access information or just need a little bit of more opportunity to talk about their health? I wondered if there's any thoughts about keeping it going afterwards, or is this quite short-term funding?
Perhaps I can pick up comments on both of those items and then let Sarah say anything she wants to. On the ambassadors piece, I think that my perception of the ambassadors is that they are coming from very specific communities, which obviously trying to get a message across to certain hard to reach communities in relation to the need to get vaccinated. I'm thinking particularly of ethnic communities. We've had a reference to Gypsy and Roma community. And to a large extent, my perception is that you need the ambassador to come out of that community. You need someone who's already in that community to be the ambassador. So I'm not certain what the role for council. I'm very happy for councillors to be involved, and Sarah can comment, but I would want us to be looking to the ambassadors within the community. And on the van point, yes, this is a very finite budget piece. Sarah can comment on the budgetary envelope for the van, but my understanding, and I sort of was part of the group that signed it off, as it were, was that this was very much aimed at the vaccination programme. Now, obviously, long term, coming out of COVID, there's going to be all sorts of learnings out of this pandemic as to health and well-being and what we might do as a council, and linking in with the NHS and across the ICS and the ICP as to how health is delivered as we move forward. But I don't know that it necessarily will be specific to the van. But Sarah, let Sarah speak.
Thank you. In terms of the ambassadors, so that's still at quite an early stage. So we've been working with the Community Conversations Forum and the individuals as part of that to sort of understand what the role could be and kind of co-produce it together. But one of the things we are planning on doing is then widening it out. So it will almost start with those individuals, but we really want to, as Graham said, to and hear from lots of different communities and have representations across the piece. It's not something we're going to be limited to. If there are councillors who wish to join that, we would welcome that. And so it's not, and so really it's trying to kind of understand which communities we're representing at the moment and where our gaps are. And so it's going to be fairly wide, but it's a relatively early point at the moment. In terms of the health of the move van, it is we have it for a limited time, but it is actually still a reasonable amount of time as well. And the idea being that it's starting with COVID vaccination, but we will have the opportunity to use it for wider health promotion. And at the moment, we are starting to look at what we can do when we bring the vaccine van to communities, what other health promotion we could bring at the same time. In the first instance, that might be looking at some of the testing for COVID as we're working with specific communities, but also there's the opportunity to use it for wider things as well. Be that, for example, blood pressure checks, and there's something that's an idea that's been suggested. But the van will be at our disposal to use for things beyond the vaccine for the lifespan that we have the van. We don't have it forever, but we do have it for a period of time.
Can I just add, I wasn't saying that the councillors themselves will get here. I was saying that they might have a knowledge of people in their communities. But I understand what Councillor Bridgman said about your focusing on particular, people within the sort of at-risk communities. And I was just thinking, and you sort of highlighted in the presentations that the previous ones, that are the low rates in particular areas and particularly in young people. So say whether one could take your van to the community centre in Greenham or whether you go to, I don't know, local places where local young people gather, and particularly that sort of, what was it, the 20, late teens to sort of 20 group that are maybe thinking they're invulnerable, whatever, probably particularly young men, I would have thought. But just some thoughts. Okay, thank you.
Thank you.
And Councillor Doherty.
Probably picking up on Councillor Vickers' second point there, and it was a combination of what Joe was saying around the Kennett Centre going to be offering walk-in clinics where you don't need to book, and the van currently being, as I understand it, booked but for appointments, and how we could combine those two things to actually get some for each. I was pleased to see the vans going to Thatcham, and that kind of covers that area off. I mean, the family centre across there is specifically in that area because of the need there. But I do wonder about whether, as Councillor Vickers has just pointed out, whether the van potentially going into the Greenham area where you've already identified you haven't got the same number of vaccines, and doing it in a walk-in way rather than having to book would actually help to address some of that that discrepancy between the numbers and percentages. And I just sort of think that combination of swapping around between having to book an appointment and making it as easy as possible to actually have a van that turns up and is there for the day, and actually community leaders, whoever they might be, could walk around and actually actively encourage that type of thing. Do you know the van's here? Have you thought about going along type of approach? So just a combination of the two.
And I did wonder if that would prompt Joe into thought. Joe.
No, I think you make a really good point, Councillor Doherty. I think this is where we're seeing the remaining logistical challenges that were a really big factor in the first quarter of the calendar year, impacting the location of vaccine delivery. I suppose the van has such a finite number of vaccination, you wouldn't want to be a victim of your own success and encourage a big queue around the block and let those people down who were hoping to receive their vaccination, which is why it has been important to be led by booked appointments as far as possible. But I do completely take your point that it kind of seems counterintuitive to be doing a very strict booked appointment only when we are just trying to get the maximum take-up possible in those sorts of areas where we've identified need a bit of a boost. But yeah, I would say that's where we're still trying to work through some of those logistical challenges.
Thank you, members. I think we now move on to PPP, Public Protection Partnership. Sean.
Thank you, Chairman. I'll just do a quick 2 or 3 minute verbal update if I may. No slides. So just since the last Outbreak board, we've continued with the step 3 visits to premises, sort of hospitality shops and the like. But these now have been primarily led with the data that we get around common exposure points, so effectively places where people who have contracted COVID may have been, just to see if there's any connection between the individual cases. So we'll continue with those visits going forward for the next couple of weeks, and that will also give the opportunity for the trade to engage with us over what comes next in step 4, the businesses to engage with us, I should say, sorry. So in terms of event work, I think what we're probably seeing now is that confidence has been growing actually the last few weeks, so we probably would move to step 4, which obviously affects some of the which would have affected the viability of some of these events had we not done so. So we are seeing basically a lot more kind of event management plans now coming in for stuff over the summer, along with risk assessments. So we're continuing to work through those. It's still a kind of high volume piece of work for us. And obviously, again, we'll engage with event organisers to discuss what effectively the step 4 provisions mean in terms of risk management. In terms of local contact tracing, obviously, as the cases have risen, as Matt's already alluded to, then the number of cases for local tracing has also started to rise. And I'm giving some thought really as to where that may go over the next few weeks. I mean, the prediction was even in, I think, at the press conference today that the cases will continue to rise in the near future. So we need to be ready for that. In terms of outbreak work, the vast majority of kind of outbreak and risk assessment, not outbreaks, but cases in risk settings, as we see them, basically a lot of those are in schools at the moment, but we are dealing with a couple of outbreaks in workplaces. and we're working with public health colleagues on those. And finally, in terms of current activity, the work of the hub, I think I mentioned last time, has formally merged with the work of public protection today. So we're able to look at cases from the point of view of not just the local contact tracing, but we're also overseeing the isolation calls as well, and some of the other hub calls that sit alongside that. So I think that's a kind of positive going forward. Just looking a little bit into the next couple of weeks and what it might mean, obviously, I think I was thinking about where we go with this, and clearly, obviously, my feeling is that businesses will probably still want to engage with us about what this may mean for them. Clearly, obviously, the regulations that put in place, the restrictions will fall away, but I'm sure there will still be questions around risk management. I mean, they're still employers, they still have visitors onto their premises. And some of the things that Matt talked about earlier on, and I think one or two of the members talked about, so things like ventilation and all those other kind of risk management issues that could be put in place. So we will do that as part of our kind of routine visits over the next couple of weeks, have a conversations, what you're thinking, where do you want to, is there anything we can advise on? Same with event organisers. Obviously, we need to look at what the new rules are going to be around isolation as well when they come out in terms of contact tracing, and get staff ready for that in terms of training and updating of staff that deal with those types of calls. And overall, really, I think it's the kind of role which I suppose feeds into Martin's bit next, which is that bit about managing public perception, public confidence, business obligations, the messaging, a lot of the stuff that we've talked about today. And we'll just get the service really geared up to play its part in all of that. Thank you, Chair.
I don't see anyone itching to ask you a question, Sean, so we'll move on to item 8, which is communications update, and Martin.
Yeah, as a Bridgman, good evening, everyone. I just have a couple of slides to share with you this evening. First of all, looking back at what we've been doing since we last met, and then looking at what's coming up. So, apologies, a bit of a duplication with good updates earlier. I'll do my best to reduce that. So, in terms of what we've been busy with over the past couple of weeks, we've heard about the Health on the Move bus and the work that's been doing last week in Lambourne and also at 217 in Newbury. We've been doing some communications about that, just to let residents know that what the bus is doing, so they see it out and about, and also to provide some reassurance that actually there is work going on there to support those harder to reach and underrepresented communities in terms of vaccinations. We'll continue to support that as we go forward, and as other opportunities to get the bus out about across the district emerge, particularly if we are able to progress to a point where there is drop-in availability, that remains to be seen.
Martin, just to pause you there, your audio is pretty blurred.
Is it? Okay. We'll just actually to see if I can do anything about that. Right. Okay. Hopefully, you should be able to hear me better. Apologies for that. So community testing has been going for some time and will do. There's been changes over time, short-term changes where there's been sort of short-term unavailability for operational reasons, and then longer-term changes as the process and remit of community testing changes. So we've been working hard to ensure that our website, our community resources and local communities themselves know how to access community testing and what those arrangements are. There's going to be further changes coming down the line, and we're getting ready to support some of those as well. As Sarah talked you through earlier on, vaccine inequality, there's an awful lot of work going on around that, and one of those 4 key strands was around communications and engagement, and we are so very much supporting that and ready to to continue doing so in the coming months as that work becomes ever more targeted and targets other groups as well, and also second vaccinations, making sure that people are taking their second vaccinations, understanding that first jabs don't give you full protection, and that even after second vaccinations it still takes a few weeks just until you have full immunity. And then I updated you at the last meeting around the work we were doing with younger adults and encouraging them to take up the vaccine, around exploring their reasons for wanting to get their jabs, and we've been continuing to promote that over recent weeks. Of course, the big news today was the move to step 4, or the confirmation that the move to step 4 in a couple of weeks' time is likely to go ahead. And of course, that has implications for us in terms of the messaging that we'll be sharing with communities over the next couple of weeks. So obviously, that's only just come out in the past couple of hours or so. So we'll be digesting that over the next 24 hours or so, and importantly, having a look at the small print in terms of the guidance around wearing face masks and so on. So just to give you an example of the areas we'll be looking at, the impact for our schools, because we know that at the moment they're still affected by the rules around self-isolation. Sean's already talked to you about the events that are going on and the need to ensure we continue supporting events and making sure those attending events and those running them know not just what they sort of can and can't do from a sort of legal perspective, but what the best practice, what the guidance is as well when they attend those events. We're going to continue supporting the vaccine inequality work that Sarah has talked about, and particularly looking at long COVID and its effects on young people. That's a piece of work that the Berkshire Shared Public Health team have started, pulling together some case studies about young people that have been affected by COVID, and encouraging others to protect themselves against COVID and long COVID. And then, of course, looking a bit further into the future, there has been some talk about the need for booster injections for some groups in the autumn, and we're just beginning to think about, actually, in terms of resource, what we might want to do for that. So we won't receive confirmation, I'm sure, about that for a little while, but that's something we are certainly beginning to look at too. So step 4, I suspect, will be the focus for us over the next couple of weeks, and lots to digest from the Prime Minister's announcement this evening. So happy to take questions on any of that.
I don't see anyone wishing to. Thank you, Martin, for that. Members, we now move to the question of future meetings. We've had this. We have this discussion at every meeting. We are booked for the 19th, which will be interesting, and the question of what step 4 will be. Oh, am I breaking up again?
We can't hear you, Councillor Bridgman.
I don't know why. Still not?
We can hear you now, but you keep coming in now.
Can hear me? No, hear me. Okay. Nods. Good. Right. I'll carry on and we'll see what happens. Members, we'll go for the 19th. I think we'll have a meeting penciled in for the 2nd of August, because we'll want to see what the reaction to step 4 is. Other than that, I've no other business. Members, do you have any other business? Right, I shall call the meeting to a close. Apologies, I think it's building. So apologies for this. If we can all remain in the meeting until Gordon confirms that it is stopped video.